Issue that concerns many American families. One Missouri man says he got an emergency room bill for more than $1,000, even though a doctor never saw his son. We are looking at that surprising bill as part of our Bill of the Month series with Kaiser Health News and NPR. Dhaval Bhatt says his wife and toddler waited to see a doctor at the hospital for more than an hour. Then they eventually left without being seen by any MD. And they were shocked when they still got a more than $1,000 bill.
The hospitals can charge you crazy amounts, and this is what I had heard from my friends.
Dhaval Bhatt, an immigrant from India, always avoided hospitals in America because he feared large medical bills. But when his 2-year-old son burned his hand on the stove in April, Bhatt's wife, Mansi, called their pediatrician, who told them, go to the hospital.
I was very much worried. The blisters came on his hand. So at that time, I was really panicked.
The hospital coded it as a level 3, a moderately severe problem. Mansi says a nurse looked at her son's vitals, looked at his wound, and said a surgeon would look at it more closely. But after waiting more than an hour, they decided to leave without seeing a doctor.
It was so annoying and frustrating. I was just thinking that why isn't someone coming to take a look at my son if his wound was so severe.
Their son's hand healed on its own after a few days, and then the hospital bill arrived. $1,012, and Bhatt owed more than $850 after the insurance adjustments. Almost all of the bill was the facility fee, something hospitals can charge for anyone who walks in and registers, even if they don't get treated.
I was really astonished to see such a crazy bill when nothing was done to my son.
After contacting the hospital several times to fix the issue, his bill was sent to collections. Bhatt says facility fees don't exist in India, and the concept of them still does not make sense to him.
If you compare it to just walking to the grocery store, you don't get charged for just entering the room or the place where you have been to. If you don't get any services, you don't pay.
Makes sense to me. Bhatt also filed a complaint with his insurance company and his state's Department of Health. No luck on either front. The hospital did eventually waive the facility fee. That was back in November after a Kaiser Health News reporter got involved, and Bhatt's bill was lowered to just $38. How they came up with $38 is a mystery. That's the cost for seeing the nurse, actually. In a statement, the hospital said the patient was treated by a nurse practitioner supervisor for a burn and referred for follow-up care. And they also said that the charge was appropriate based on factors including a traumatic wound assessment, adding that they post information about pricing online and at their care sites. The editor-in-chief of Kaiser Health News, Dr. Elisabeth Rosenthal, joins us now. Elizabeth, it makes sense to me to be shocked at a facility fee. You think if you walk in, if you're not seen and getting detailed care, you're not going to get a bill just for, having the doors open. But apparently it's common practice. So what are facility fees and how regular are they?
Yeah, right. Facilities fees are a construct of American medicine. Well, actually, American medical billing. They're basically a room usage fee. And they started when emergency rooms said, look, we need facility fees to cover the cost of overhead 24/7. But they've trickled down now. So we even get facility fees for people who are doing telemedicine visits when they're sitting in their own bedroom, I'm already paying rent for that. And, in emergency rooms, they can be a lot. They're often the biggest part of the bill.
So as a parent, there are often issues that are kind of on the line where something is urgent, but you're not sure if you should wait a day and go to the pediatrician or go to the ER, as this family did. So when people consider an emergency room visit, what factors should they evaluate?
Well, I can't give medical advice, but often there is that moment of panic. And you should know that if you go to an emergency room, A, the charges are going to be very, very high. And B, especially during the pandemic, waits are likely to be long and you'll get exposure there. And emergency rooms, they treat people based on how sick they are, not based on how long you wait. So it's worth thinking twice, calling a doctor, visiting urgent care, something like that.
So when it comes to ERs, I mean, most things in your life, you can call around to a couple retailers, ask the price of something. If you want to order a pizza, you can check a few menus. Can you do that for emergency rooms? Is there a way of knowing the price ahead of time and price comparing?
Well, I mean, if you have a degree in coding and medical billing, probably.
Right.
All hospitals since 2019 have to post their charge masters, their master price list online, but they're often in code and they're hundreds of pages long. And ER facility fees come in levels 1 to 5, which each level up being charged more. So in theory, you could know, but in practice, it's impossible.
Dr. Elisabeth Rosenthal, thank you very much for laying it out so clearly. Much appreciated. We'll see you again soon.